This work that BMS does to bring the voice of industry and patients together to Parliament is important work.
So the theme of our 4th annual Patient and Parliament Summit this year is around productivity, linking patients, policy and productivity. And we've brought 20 plus patient organisations to be with us to talk about their personal experiences and how access to medicines can really have an impact on productivity of this nation.
We've got a once-in-a-generation opportunity here with a new government committed to driving prosperity and productivity in Australia and an HTA reform programme that's coming to fruition to bring those things together and to infuse new ambition into how we access and assess the value of new medicines.
I think real stories are important because it's when you live with a condition that you know what it means for you and your life and your work and your family.
I was diagnosed with esophageal cancer in 2023. 6 months before I was diagnosed, immunotherapy was approved under the PBS to enable me to have this immunotherapy following my surgery, which enabled me to continue working throughout my treatment, continue to be a dad and be there for my children throughout my treatment, compared to the other option, which would have been going through an aggressive form of chemotherapy, which would have left me fairly incapacitated. Without the patient voice to have been able to advocate to have these drugs under the PBS, I wouldn't be here. I don't know if I'd be alive today and functioning as well as I am.
But I think novel therapies and getting decisions where people can get access to these are so important for people with chronic disease because they need to have choices.
But unless we have a healthy population, we don't have a healthy economy, we don't have anything. And we need to think about the fact that we don't live in an economy. We live in a community where we love and care and cherish our friends and our neighbours.
And what we've heard here today are some incredible stories about the impact not just of the disease, but also of the access to treatment that patients get, or the lack of access to treatment that they get, and what impact that can have on their lives. And when policymakers hear that directly from a person impacted, it really informs their understanding of what they should do to improve our medicines access system and the health system more broadly.
And at the end of the day, when we're making decisions, we really need to understand, well, what do the patients want? It's really important to bring all these people together in one room, and we're thankful for BMS for allowing that to do so.